Hi, it's Bill, the Knee Pain Guru. Welcome to the video today, live video presentation on how to quickly relieve knee pain. We're going to talk about understanding how to get the knee out of pain as quickly as possible. We will be answering questions today. These are all the videos that I do. These live presentations are interactive. They're live Q&A. So if you do have a question, go over in the comments section on the side and enter in your question, where when I'm done with the presentation, I'll answer your questions, whether it be around knee pain, your diagnosis, doctors, physical therapists, you're feeling stuck and frustrated, you don't know what to do, you're thinking you're looking at a surgery or a knee replacement or whatever it is, stuck with lack of range of motion, whatever it is. Enter your question over on the side and we will address those momentarily. Make sure to give the video a thumbs up, like and subscribe to my channel, The Knee Pain Guru, as well as turn on notifications. There's a little bell when you subscribe to the channel. It turns on notifications because I'm doing these videos about twice a week. We may cut that down to once a week. It's been getting busy. A lot of people with knee pain. Okay, so now we're going to go into how to quickly relieve knee pain. And surprisingly enough, this has been my life's work the past 21 years since I blew up my own knee. Dislocated my left knee 4 times, had reconstructive surgery on my ligament in my left knee, had 2 pieces of meniscus removed. So I have both firsthand knowledge as well as several decades of experience on getting myself and thousands of clients out of pain over that period of time. And I have found the biggest challenge getting people out of pain is not so much their knee as much as their mindset. And we're going to go into that in just a moment. So I got a quote for you. And most people have heard this. I've seen it in driving videos. The shortest distance between 2 points is a straight line. And this is really important. Remember this. The shortest distance between 2 points is a straight line. And your shortest distance between where you are in pain and where you are out of pain is by not creating more pain. And it sounds super simple. Most people miss this. I bet you will. You'll think, okay, that's too simple. Of course, duh, that makes sense. However, most people miss it. And those that do hear it then don't understand what I'm talking about. So I have 3 steps that are going to help you the most in terms of how to quickly relieve your knee pain. First is accept the reality that making your knee hurt in any way will move you further away from getting out of pain. So you're here in pain. This is you trying to get out of pain. Anytime you cause pain, it moves you further away. Basic, fundamental understanding. You don't need letters after your name. You don't need to go to medical school. You don't need to understand anatomy and physiology. Understanding this first step of what I'm talking about, that accepting the reality that creating pain in your knee in any way, shape, or form is actually going to move you further away from getting out of pain. Basic, fundamental. That's a mindset piece. That has nothing to do with exercise. That has nothing to do with strengthening your legs. That has nothing to do with stretching or yoga or any of the practitioners or doctors or physical therapists you go to. Understanding that mindset concept, anytime you create more pain in your knee, is going to move you further away from getting out of pain. That's what we're going to start with. That's the first step. Second step is stop doing the things that make your knee hurt. Basic. Stop doing the things that are making your knee hurt. Now, I know what you're thinking. You're like, yeah, Bill, but I got to live. I have kids. I have grandkids. I have to do this. I have to do that. I have my laundry list of stuff. Not denying that. But how many times are you doing shit that you don't need to do? How many things on that list are nice to get done, but they aren't essential? You going to the bathroom is essential. You doing basic hygiene is essential. You feeding yourself is essential. Taking the dog for a walk? Maybe. Maybe someone else could do it. Going to the grocery store? Maybe. Maybe someone else can do it. So it's about understanding how to prioritize what's important in your life. Is getting all of that laundry list of things done that important that is costing you the quality of life that you want, moving you further away from getting out of pain? And I get it. I understand there's this place where, okay, what do I do, Bill? I can't just sit on the couch all the time. Get it. We're going to get to step 3. Step 3. We will get to that. The point of it is we have to set up the mental mindset first to get you in a place so you're going to succeed. And the only way you're going to succeed is stop doing the things that are moving you further away from getting out of pain. I'll repeat this again. The biggest challenge people getting out of knee pain is not their knee, is not exercise, is not all of the things that they're doing. It's their mindset. Now we're going to go to third step. Third step to how to quickly relieve knee pain is beginning to create comfort in your knee. Now, what does comfort mean? Comfort is a little bit of a vague concept. Sitting on the couch with your leg propped up doing RICE therapy, rest, ice, compression, elevation, the buzzword that the doctors and the PTs will send you doing. Do RICE therapy. Okay, I got my ACE bandage on my knee and I got the ice and my leg is propped up on pillows and I'm sitting on the couch and I'm watching television and I'm staying off of it. That's not comfort. It's not comfort. It just isn't. Sitting on your ass, not doing anything doesn't necessarily make your knee comfortable. This is an important point. Comfort is understanding how to get the pressure off of the tiny little nerves in the knee, the width of an eyelash. And this is a basic, fundamental understanding of what's causing pain in your knee. Tiny little nerves, the width of an eyelash, being squeezed. This is in your knee. Being squeezed, sending a signal to your brain that you have pain. Just like a splinter in your finger. Tiny little splinter can cause your finger to swell up. And it can only be a little sliver of something. That same level of, that same concept can be applied to your knee. What's going on with your knee? And when we have a tiny little nerve in your knee, the width of an eyelash being squeezed, sends a signal to your brain that you have pain. What happens? Causes your knee to tense up, tighten up, squeeze together, reduce space. Sounds a lot like arthritis. Sounds a lot like bone on bone. Sounds a lot like what the x-rays, the CT scans, and the MRIs look like when you go to the doctor and you want an answer why your knee hurts. Oh, well, that just happens when you get older. It's because it's a normal, natural response to a pain, to an injury, to an accident, to a surgery, to some sort of trauma your body has experienced. Causes your body to tense up to protect itself. That tension sets up all the conditions that you're dealing with, whatever your diagnosis is. Chondromalacia, patellotendinitis, patellofemoral syndrome, arthritis, osteoarthritis, bone on bone. I'm trying to think. All of them, all of those different diagnoses are a direct result of this tension pattern that is going on in your knee that is setting up the conditions for your joint to dehydrate and for it to hurt more. And the more it hurts, the tighter it gets, the drier the joint gets. All diagnosis of arthritis is dehydrated joint, which sets up the conditions. So your knee joint wears and you're going to be in pain. I think most people call it old age. That's just what happens. There's nothing you can do. Just going to have to deal with it, use it or lose it. Keep pushing through the pain, which actually accelerates the problem. So creating comfort, getting that pressure off of that nerve, does several things. One, you get relief. Two, you start tapping into the neurological responses that is causing the knee to tighten up to begin with, causing your body to tighten up to begin with. So just like when you feel pain, your whole body tenses up, when your knee feels comfort, your whole body relaxes. The knee relaxes, up and down the leg relaxes, begins to relax in the hips and lower back. You can breathe easier. There's lots of physiological responses that happen as a result of learning how to create comfort in the knee. When you create comfort in the knee, the body begins to relax. It has more space. When there's more space, there's less pressure on the nerve. Less pressure on the nerve, that means it's more comfortable. So all we're not doing anything different than what your body did unconsciously to get into pain. Now we're getting it out of pain. So that's how you quickly relieve knee pain. We'll go over those real quick, 3 points. And if you got questions about what's going on in your knee, type those in the comments section over on the side. So going over those 3 points again. First, the mindset. It's a mindset piece. Accept the reality that making your knee hurt in any way will move you further away from getting out of pain. That's the first step. Second step is stop doing the things that make your knee hurt. And then third, beginning to learn how to create comfort. Comfort on the pressure of the nerve that's causing the pain. You want to learn how to get the knee comfortable? I have a 7-day knee pain reduction challenge that you can take. It's free. No cost or obligation to you. It's over on my website, thekneepainguru.com. I am going to put the link in the comment section over on the side. And you can go over there, take that challenge, and begin to learn how to do this. You got questions? Put it over on the side. And if not, I'm going to scoot because I have group coaching calls that I will have here shortly where I work with clients to give them the specific stretches that relieve the pressure off of the nerves in the specific part of the knee. Because the front of your knee, the kneecap, is a different stretch than if the pain is in the back of your knee, like a Baker's cyst, or on the inside of your knee, if it's a case of arthritis, or if it's on the outside of your knee, or the front of the knee. So there's different tension patterns. And understand these tension patterns go up the leg and down the leg and in the hips and lower back, which is why you feel fatigued early in the morning, because your body is compensating from not being able to sleep the night before. And then now it's like you're dragging around this boat anchor because the leg is stiff, having problems. You're constantly thinking about it. Mental, emotional, physical fatigue takes its toll over time. You don't have questions? Got it? Give the video a thumbs up, like and subscribe to my channel, and turn on the notifications. I do these videos throughout the week, multiple times per week, possibly, maybe going down to one. Big thing with any of my programs, products, is participation. You don't participate, you don't get better. That's how it works. And it's best to get that out of the way now, because if you don't like what I'm saying now, you certainly aren't going to like it when you get into one of my programs. Okay, cool. I'm going to scoot. I have other things I'm going to do. Thank you so much for being here. Once again, give the video a thumbs up, like and subscribe to my channel, and turn on notifications. This is Bill Paravano, the Knee Pain Guru, wishing you a wonderful day, and I will see you on the next video.